Hi everyone, welcome back to my YouTube channel and today we are going to talk about leukoplakia. So let's start our topic with introduction. Leukoplakia is a white patch or plaque that develops on the oral mucosa and cannot be rubbed off and cannot be clinically or histologically characterized as any other disease. It is considered a potentially malignant disorder, meaning it carries a risk of transforming into oral cancer, particularly squamous cell carcinoma. It is the most common pre-malignant lesion of the mouth. Definition of leukoplakia. According to World Health Organization, leukoplakia is defined as a white patch or plaque of the oral mucosa that cannot be scraped off and cannot be characterized clinically or pathologically as any other disease. This definition is one of the exclusion, meaning all other causes of white oral lesion must first be ruled out. Epidemiology of leukoplakia. Leukoplakia typically occur in adults over 40 years with a higher prevalence in males. Its global prevalence ranges between 1% to 4% of the population. However, with increasing tobacco use among both genders, the male to female differences is narrowing. The risk of malignant transformation is estimated between 1% and 20%, depending on the lesion type and risk factors. Etiology of leukoplakia. Leukoplakia may be idiopathic, but several major risk factors are strongly associated. They include tobacco use, that is, cigarette smoking, BD, cigars, and pipes. Smokeless tobacco, that include pan, gutka, naswar, and chewing tobacco. Tobacco is the most significant and common cause of leukoplakia. Number second is alcohol consumption, as excessive alcohol acts synergistically with tobacco, increasing risk of malignant transformation. Third is chronic irritation that may be because of sharp teeth, faulty dental restoration, ill-fitting dentures. Chronic mechanical irritation may contribute to epithelial changes, causing leukoplakia. Fourth is nutritional deficiency, as deficiency of vitamin A and iron may predispose individual to mucosal keratinization. Fifth is human papillomavirus, as certain strains, like especially human papillomavirus 16, have been associated with leukoplakia and dysplastic changes. Clinical features of leukoplakia. Leukoplakia presents as persistent white patch that cannot be wiped away. Common sites of it include buccal mucosa, lateral tongue, sore of mouth, gingiva, and soft palate. Then there are types of leukoplakia. There are two types: homogeneous leukoplakia and non-homogeneous leukoplakia. Homogeneous leukoplakia, there is uniform white, thin, smooth, or wrinkled surface. There is lower risk of malignant transformation in case of homogeneous leukoplakia. Second is non-homogeneous leukoplakia, that includes nodular, verrucous, and speckled types, that is also called as erythroleukoplakia. It has irregular surface, red and white areas, and higher risk of malignancy. Histopathology of leukoplakia. The microscopic examination may show hyperkeratosis, that is thick keratin layer, acanthosis, that is thickened epithelium, epithelial dysplasia, that may be mild, moderate, or severe, nuclear pleomorphism, hyperchromatism, increased mitotic activity, loss of normal epithelial stratification, and presence of dysplasia that increase the risk of malignant transformation significant. Differential diagnosis. Before diagnosing leukoplakia, other violations must be ruled out, such as oral candidiosis that can be scraped off, lichen planus, frictional keratosis, chemical burns, white sponge nevus, nicotine stomatitis, and correct diagnosis require proper clinical examination and often biopsy. Malignant transformation of leukoplakia. Leukoplakia is a potentially malignant disorder, and transformation into oral cancer is most likely in non-homogeneous lesions, lesions on tongue or floor of mouth, long-standing lesions, presence of epithelial dysplasia, patient who continue smoking or alcohol use. The transformation rates varies from 1% to 20% depending on the risk factors. Diagnosis of leukoplakia. Diagnosis is mainly clinical, that is supported by clinical examination, that is detailed history of habits and careful inspection of the lesion. Second, it may include biopsy, that is essential to determine presence and grade of dysplasia. It can be essential biopsy and excisional biopsy. Third is additional tests that may include toluidine blue staining, brush biopsy, autofluorescence screening, and these aid in detecting suspicious area but do not replace biopsy. Management. Management of focus on eliminating risk factors and treating the lesions. They include habit cessation, that is complete stop of tobacco and alcohol, and counseling and nicotine replacement therapy if needed. Second, we can do is removal of local irritants that includes smoothing sharp teeth, fixing defective restoration, and adjusting ill-fitting dentures. Third, we can do is medical management that include antioxidants like vitamin A, C, and E, topical retinoids. They may help but are not definitive treatment. Fourth, management strategy includes surgical management that's indicated for higher risk lesion. Their method include excision with scalpel, laser excision, cryotherapy, and electrocautery. Fifth, management strategy is regular follow-up. That is, even after treatment, lifelong follow-up is required because recurrence and transformation may occur. Prevention of leukoplakia. It is done by primary prevention, that is to avoid tobacco in all form, limit alcohol consumption, maintain oral hygiene, and balance diet that is rich in vitamins. Secondary prevention include early detection through regular dental checkups, screening high-risk individuals, and monitoring precancerous changes. Conclusion of this lecture video. Leukoplakia is a significant pre-malignant condition of the oral cavity that is strongly associated with tobacco and alcohol use. Early detection, proper diagnosis through biopsy, and timely intervention are essential to prevent malignant transformation. Lifestyle modification play a crucial role in both prevention and management. Regular follow-up remains vital to ensure long-term health and reduce cancer risk. And this was all about leukoplakia. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.